The human immunodeficiency virus weakens the immune system and eventually leads to acquired immunodeficiency syndrome. This leads to a decreased ability to fight off infection. Symptoms can be compared to the flu, such as headache, diarrhea, nausea, vomiting, fatigue, aching muscles, sore throat, swollen lymph nodes, and fever. Comorbidities against patients with HIV include diabetes mellitus, cardiovascular disease, respiratory disease, and hepatic disease. Risk factors include having unprotected sex, having another STI, sharing intravenous drugs, lack of circumcision increases the risk of heterosexual transmission of HIV.
All right, so when looking at the public health impact of AIDS from a global perspective, you can see that 34 million tested positive for HIV, but the good news is less and less of those people are actually dying from AIDS due to all the treatments and medications that we've developed over the years. So, biggest takeaway when looking to keep these numbers trending downward is just proper education and spreading public awareness on how to go about having safe sex, safer drug use, and these types of practices that are just going to help overall less people even get HIV in the first place.
Occupational therapy plays a crucial role in assisting people living with AIDS to re-engage with life in regards to self-care, leisure, and productivity. A number of barriers for people living with AIDS returning to work exist. One major issue is the possibility of losing disability payments/benefits. But medications are effective in fighting HIV and the complications that coincide. Nucleoside reverse transcript inhibitors interrupt the virus from duplicating, which may slow the repeat of HIV in the body. Protease inhibitors interrupt virus replication at a later step in the virus life cycle. Fusion inhibitors prevent the virus from fusing with the inside of the cell, preventing it from replicating. Highly active antiretroviral therapy slows the rate at which the HIV replicates itself. Non-nucleoside reverse transcript inhibitors block the infection of new cells by HIV.
HIV infects and kills the CD4 cells, which function as regulators and amplifiers of the immune system. In the absence of effective antiretroviral therapy, the decrease in CD4 cells during AIDS results in a weakened immune system, which impairs the body's ability to fight infections or certain cancers. AIDS is the most advanced stage of the HIV infection. To be diagnosed with AIDS, a person with HIV must have an AIDS-defining condition or a CD4 count less than 200 cells per cubic millimeter. The major mechanism for CD4 cell depletion is cell death, or apoptosis, which can be induced by HIV through multiple pathways. Death of HIV-infected cells can result from the tendency of infected lymphocytes to form a short-lived syncytia, or from an increased susceptibility of the cells to death.
To my dear mother, currently riding an elevator, HIV is a treatable virus when caught early on, but it is not curable. HIV is not a demographic disease as once believed. HIV is a sexually transmitted disease, but it can also be transmitted via needle usage involving drugs and other high-risk activities such as unprotected sex. AIDS is the matured progression of sickness which develops from the HIV virus itself. Time and scientific research has proven that HIV is a manageable disease, and it has also allowed the public a safe and realistic protocol to controlling HIV. The good news, Mom, is HIV is on the decline, and hopefully one day we will see an HIV-free world. Haiku. Prevent HIV, everyone should get treated, or else you'll get AIDS.